Hello, my name is Will and welcome to part 2 of a series that's looking to teach you a little bit about the body whilst getting you active. Now, in our previous session we focused around the skeletal system, and in today's session we are going to focus on the muscular system. As a reminder, the content for this particular video is coming from the OCR GCSE PE specification. However, it is not just for students, it's for people from all walks of life in order to help build their knowledge and understanding of their bodies to help them live healthier and more active lives. So in relation to the muscular system, there's a few things that we're going to be looking at. First of all, we're going to look at the names of some of these muscles. We're then going to be thinking about how they work together and also then some of the movements that they do complete. Now, this is something that we will progressively build up over time, and it is worthwhile doing a little bit more research into additional muscles as we're only going to be looking at a small number, as this is just an introduction. Okay, so we're going to start with what is visible from the front in relation to our upper body, starting with our shoulder. So the muscle associated with the shoulder is known as the deltoid. There are actually 3 variations of deltoid at the shoulder, but we're just going to know it as the group of deltoids, or we can know it as the deltoid. We then have our pectoral muscles, so our major chest muscles. We then have our biceps, which are the ones that sit on the top, our triceps, which sit underneath, and our abdominal muscles. Focusing still on our upper body, but this time these muscles are much more visible from the back. We have our trapezius muscle, which is a muscle sat at the very top, a triangular muscle involved in a number of significant movements. Down the sides, we have our latissimus dorsi, and then also bridging between our upper body and our lower body, we have our gluteals, which is essentially the muscle that you would associate with your bum. Moving now to our lower body, just a few muscles to bear in mind. First of all, you have got your quadricep, which is the muscle that sits on the front of your legs that cover your femur. Remember, that's the biggest bone in the body, very, very tough bone. And then on the back, its partner is known as the hamstrings. As you then move down to your calf muscle, you have a muscle known as your gastrocnemius. And although this one is not on the syllabus for the OCR GCSE specification, I always think that it's helpful to remember the muscle that is sat at the front, which is known as the tibialis anterior. Now, although I introduce each of these muscles individually, what is really important to remember is that they all have a similar characteristic in the sense that they can only pull. Now, as a result of this characteristic, we have to start considering how these muscles interact in order to cause movement, because obviously, if we think about our biceps, if our biceps can only pull, that will explain how flexion works, but it does not explain how extension works. To understand how opposite movements occur, we need to understand the term antagonistic pairs. This term refers to the idea that 2 muscles will work together in order to cause movement. So if we stay focused in on the elbow joint, we would need to pair the biceps with the triceps. Now, the biceps are going to be associated with flexion, as we already understand, and that's because there is an attachment point on both sides of the elbow joint. Now, as that is the case, when the biceps contract, that will pull that upper arm towards the shoulder. Now, that will get it to stay there, but then we need to think about the triceps. The triceps at this point will need to take over to extend the arm. That is because, like the biceps, they have got an attachment point over the elbow joint, so when it contracts, it is able to extend the arm. In relation to antagonistic pairs, you need to also understand 2 key terms. One is agonist and the other is antagonist. Now, the agonist is the muscle that is contracting or working. So in the case of flexion, at this point, we would know our agonist as our biceps. However, the antagonist is the muscle that is relaxing or lengthening. So whilst your biceps are your agonist, your triceps will be your antagonist. Now, when you're then looking to reverse the movement, so in this case going from flexion to extension, those roles will change. The triceps that were originally our antagonist will now become the working muscle, so they become our agonist. And in opposite, the biceps, which were originally contracting as our agonist, are now lengthening and relaxing, which means they become our antagonist. Now, a third term that's really important to understand is fixator. Fixator, often known as fixator muscle, is relating to a muscle within the body that's preventing unwanted movement from occurring during a specific movement. So in the case of a bicep curl, the deltoid will act as a fixator muscle, preventing that unwanted movement, and in this case that would be the raising of the arm. Two really clear-cut examples of antagonistic pairs relate to our biceps and triceps, as well as our quadriceps and our hamstrings. So now that we know the names of a number of muscles and we understand how they will work together in order to cause movement, we now need to start considering the types of movement that can happen within our body. Now the two that we're going to focus in on at the start we've already mentioned, that is flexion and extension. Flexion is referring to a decrease in an angle at a joint, whereas extension is referring to an increase at an angle at a joint. So if we look at a chest pass in netball, when we bring the ball to our chest in the preparation phase, you can see that there is flexion going on at the elbow. When we then go to push that pass to someone on the court, we extend those elbows, so extension is occurring. If we think about in relation to a kick in football, when we are bringing our leg back to prepare to kick, that would be known as extension. And then when we go to actually kick the ball, we follow through and we are coming forward. That is where we are thinking about flexion occurring. Two more types of movements are known as adduction and abduction. When you think of abduction, so not adduction, abduction, we think about the movement away from the midline of the body. So if you think about a jumping jack, for example, as you're bringing your arms away from the midline of your body, that is known as abduction. And if we think about then bringing those arms back towards the middle of the body following the second phase of a jumping jack, that is known as adduction. So the final two terms that I want to introduce to you are circumduction and rotation. Circumduction refers to a circular movement that essentially is combining together multiple movements. Now, if we think in the case of a bowl within cricket, as we come round and we bowl, at the shoulder joint, circumduction is happening because that circular motion is happening in order to generate the pace to actually bowl the ball. Now, in relation to a rotation, that's much more of a twisting action. So the action of, for example, turning my palm from facing upwards to downwards is an example of rotation. And if we think about maybe a golf shot or a golf swing, as we come through this movement, there is a twisting action happening at the hip joint. This would be known as rotation. So following this short video, hopefully you now have a bit of a better understanding of some of the major muscles within our body, how they work together to cause movement, and also some of the major movements that can occur. Now this particular video is now going to be paired with a workout which will get you active whilst giving you the opportunity to test the knowledge based off this video. But for now, please do make sure you like this video, share it, and subscribe to our Serotonin YouTube channel. And later on in the week, please do be sure to come and join us for that workout. But for now, please have an amazing week and see you soon.